Hello and welcome to Sureena Speaks. And a question that I've been asked a lot is actually, what kind of questions come up in the exam? Now that's quite hard a question to answer because really and truly they could ask anything, which can seem scary, but we'll try and prepare ourselves as much as we can. So what I've done is I've grouped particular questions into four main subgroups. I mean, you probably could break them down into even further groups, but let's just roll with this. So there's direct questions, case-based questions, over-the-counter questions, and other or obscure, whichever one you want to call it. Now, these can overlap within each other, but let's try and give a few examples of what I actually mean by these. So direct questions. So by direct questions, I mean a statement will be given and it will be you trying to figure out what the answer is based on the list of options they're given. So for example, it could be something like, what is the side effect of metformin? Or what is a side effect of aminosalicylates? That question, if we stick to aminosalicylates, that question could actually be worded in numerous ways, but still be asking for the same thing. So they could say a person, well, in the style of a case-based question, for example, they could say a person is on mesalazine, on mebeverine, and buscopan. Let's just pretend that all those medicines can go together. And they might say that now a patient has developed a random cough, even though it's not flu season, and they've got this random bruises on their arm. What would be their next step? And the list of options might include they should take some syrup for their cough, they should put on some Savalon cream for their bruise, or they should be referred. And the answer would be they would need to be referred because those signs and symptoms show that this is bone marrow suppression. And with mesalazine, with aminosalicylates, we need to be really careful about bone marrow suppression. So any symptoms that a patient may exhibit that is to do with bone marrow suppression, we need to refer them. So see, it's the same question that they could ask, but in a direct way, where it's just simply put, persons on aminosalicylates, what do they need to be aware of? Or they could do it in this case-based way, where they give you this wonderful backstory and you then have to figure out which the answers are. Another example of direct questions could be, for example, what is the maximum dose of a particular medication in a day? So what is the maximum dose of paracetamol? What is the maximum dose of aspirin? What's the maximum dose of ibuprofen? And a point to note is that, remember, they can creep in calculation questions in the clinical paper, which you need to be able to do without a calculator. And classic ones of these would be, for example, your paracetamol and ibuprofen suspensions. So you might have a 5-year-old that needs to take paracetamol 120 milligram per 5 ml. What dose would need to be given to them? And that's something that you just sort of need to know off the top of your head and you need to learn. They probably won't even give you an extract for you to work that out. So make sure to go over that. For paracetamol, for ibuprofen, I'd even say for Piriton as well. Because remember, 20% of the paper will be on paediatric questions, and this is the style and type of question which would come under that. Other direct questions include counselling points. So a patient is on flucloxacillin. What counselling point would you give with it? So before food, at least an hour before food, or they're now taking naproxen. Again, what counselling points would we need to give? Okay, in this case, it would be after food. So again, it's a statement that they've given, and then you have to determine from the list of options what that answer would be. They could also ask with regards to monitoring and testing patients. So if a patient is on a high-risk medication such as warfarin, amiodarone, digoxin, theophylline, what do we need to look out for? What do we need to be aware of? Even non-high-risk medications such as simvastatin, what do we need to monitor in these patients? What tests would we need to do? And usually, again, that would just be written as a direct question. Continuing with more examples are, for example, definitions, and definitions is such a classic example of a direct question. So they might say, what is the definition for a patient group direction? Or what is the definition for medicines optimization? What is the definition for tardive dyskinesia, for dystonia? Those two, by the way, check chapter 4. my video on chapter 4 because the answer's there. Other examples include in the case of overdose. So if a patient is overdosed with paracetamol, with theophylline, with any sort of medication, what would we need to do? Is there an antidote available? Do we need to give activated charcoal? So again, these are all examples of direct questions. So they could also ask questions to do with vaccines. So, for example, you have a 5-year-old, would they still need to be vaccinated against MMR? Or you have a 12-year-old girl, when would it be suitable for her to have the HPV vaccine? Again, these are all direct questions. Also be aware of, in the case of diabetes, do you know which examples of your different types of insulins, your insulin detamir, your insulin glargine, your aspart, do you know examples of those? Do you know how for example, pioglitazone works, how acarbose works, how metformin works? And they could just ask that. They might say, how does pioglitazone work? How does acarbose work? So it's a direct question where it's a statement and they want you to be able to figure out what the answer is for that statement. In contrast to that is our case-based questions. And our case-based questions is when they give us this wonderful flowery scenario, and from that we then need to establish what the answer is. And with a lot of these case-based scenarios, they try and plug in a few red herrings just to sort of catch us out a little bit, because we know they like to do that. So an example could be you have a 63-year-old male patient who is currently taking metformin 500 milligrams twice a day. His doctor has taken his blood pressure and has now decided that he needs to be on blood pressure tablets. Which of the following would be most suitable? And of that list, we might have ramipril, amlodipine, losartan, and bisoprolol. So we'll look at that statement. Okay, he's 63 years old. Usually when we're looking at questions to do with blood pressure, we'll think of our pathway. So are they under 55 or if they're over 55? If they're under 55, ACE inhibitor or an ARB is the first line. If that's not suitable, then we go down to calcium channel blocker, etc. If they're over 55, first line would be calcium channel blocker, second line would be their ACE inhibitor and ARB, etc. And we might be tempted to go through that way when we're answering this question. And yes, it is important to note that this patient is 63, so he's over 55. So we might be tempted to think, okay, he's over 55, first line would be calcium channel blocker, therefore the answer is amlodipine. But read the whole question carefully. He's a diabetic. With diabetic patients, regardless of their age, first line will always be an ACE inhibitor. And so in this case, the answer would actually be ramipril. So whilst we might think, okay, over 55, amlodipine. No, he's diabetic. Don't worry about the age. And in a situation like that, that's a classic situation in which a red herring can pop up, which is actually the age in this situation. Other case-based questions could be a patient is suffering from alcoholism, and because of that, they've now developed Wernicke's encephalopathy. They might try and plug in that the patient's age, their gender, their blood group, who knows? I mean, they could literally put in anything. But then the question would be, okay, they've got Wernicke's encephalopathy, which vitamin would be necessary for them to take? And then they might have vitamin A, vitamin B1, vitamin B12, vitamin C, vitamin D. And in this case, when it comes to alcoholism, and when it comes to Wernicke's encephalopathy, it's vitamin B1, it's thiamine. In the same situation, they could give a question that a person is suffering really bad bleeding of the gums, really severe bleeding of the gums. Which vitamin are they lacking? Okay, in this case, it would be vitamin C, because the description that they could give would be of scurvy. So whereas with the direct questions, it's give a definition, give a side effect. With the case-based ones, it's trying to make you think of a whole scenario and trying to implement your knowledge using that scenario. Another example of a case-based scenario could be a 22-year-old woman comes to see you because she wants the emergency hormonal contraceptive. So the scenario goes on to say, when speaking to this patient, you find out that she takes some regular medication. She might be taking amlodipine, carbamazepine, and paracetamol when required for a headache. Can she still take the hormonal contraceptive? So they'll add in random medication in there, such as the amlodipine and the paracetamol, to kind of put you off. But in this case, it's the carbamazepine that we need to be aware of, because actually carbamazepine has an effect on the emergency hormonal contraceptive, making it less effective. Therefore, in this situation, it would be better for the patient to actually be referred on to their GP. Another example could be that a patient is newly diagnosed, or a patient is newly being put on isosorbide mononitrate, and they need to take it twice a day. What time of day would it be best for them to take it at? And we might jump to conclusions and think, okay, if it's twice a day usually indicates 12 hours apart. Therefore, I'm going to say they should take it at 8 AM and 8 PM. No. It's isosorbide mononitrate. It's a nitrate. With nitrates, we need to ensure that patients have something called a nitrate-free period. So in this case, actually with isosorbide mononitrate, when it needs to be given twice a day, 8 AM, 2 PM. That way in the evening, they have that nitrate-free period, so they don't then develop this sort of tolerance towards the nitrates. So I hope that kind of sums up what I mean by a direct question and by a case-based question. And remember, some of the questions will be, this is the question, is it A, B, C, D, E? And the other part of the paper will be, here is a list of options, which of these statements matches to which of these options? And in either instance, they could do that in a direct way or flower it up with a case scenario. So that's that. Moving on to over-the-counter. Okay, so again with over-the-counter, they could do it in a direct way or they could do it with a case scenario. So they could say that a mum comes in with her 11-year-old daughter and she needs hydrocortisone cream over the counter. Can you supply it? So you'll be thinking, okay, they want hydrocortisone cream. She's an 11-year-old girl. Yeah, that's fine, because I know hydrocortisone needs to be given above 10 years old. Okay, but now the question might change and it might say, a mum comes in with her daughter who's 11 years old, she has a rash on her face, she wants hydrocortisone over the counter. Again, we'll be thinking, okay, she's above 10 years old, she's 11, so it's fine to give it, but hang on a second, it's being given for the face. And hydrocortisone 1% cannot be given or sold over the counter in those that are under 10 years old for the face, anogenital, or broken or infected skin. So actually, sorry darling, but you won't be able to have it because we can't be giving it on the face. Another example of an over-the-counter question could be, again, it could be an age-restricted question. So you have a 5-year-old with conjunctivitis. Can you give chloramphenicol eye drops? Well, yeah, they're 5 years old. Above 2 years old, I can. They might say you have an 18-month-old baby that needs chloramphenicol eye drops. Can you give it over the counter? No, because they're 18 months old. They're under 2 years old, so therefore I can't. With the over-the-counter questions, a lot of the time they do like to give pictures. So they could give a picture of some yellow crusting around the mouth of a baby, which could indicate impetigo, or they could give a picture of chicken pox or mumps, measles, any sort of skin disorder. So make sure you're aware of what they look like and how you can differentiate one from the other. Another example of over-the-counter could be you have a patient who has a really bad dry cough. Which of these excipients would be best for them? So dry cough, okay, glycerol, that would be a good example. Diphenhydramine, that would be another good example. Or the question could be a patient has a really bad chesty cough. Which of these would be good? Okay, in this case, something like with guanfacine would be good because that can help loosen that mucus. So I hope you're getting now an idea of the kind and styles of over-the-counter questions that they could give. They might introduce some of the legal restrictions. So, for example, they might say a person wants to buy 4 packets of paracetamol each packet contains 32 tablets. Can you proceed with this transaction? Well, no, because over the counter with paracetamol tablets, we can only supply less than 100 tablets. But if it was, if they changed it and they said a patient wants to buy 4 packets of effervescent paracetamol, each packet contains 32 effervescent tablets, can we proceed with this transaction? Well, yeah, because there's no actual limit when it comes to effervescent paracetamol. But remember, always use your discretion. Another example of a question for over-the-counter could be with laxatives. A patient comes in, they haven't been able to go and open their bowels for a few days, they've been really uncomfortable, and they want you to give them or recommend something that's going to work as little time as possible, something that's going to work really, really quickly. Which of these options would be best? And then they might have lactulose on that list, fibergel, Senna, Macrogol, and the answer to that would be Senna, because Senna would be the fastest acting. Or they could say a patient has had really bad constipation the last few days. They did some research and they found that actually taking an osmotic laxative could benefit them. Which of these are an osmotic laxative? And the answer to that, the lactulose. It's the same question that they could ask, but in different styles and in different ways. So now we move on to the obscure or other section. And the reason I call it that is because these aren't necessarily areas which you would have seen the BNF or the MEP or even to do with over the counter. These might actually be sections that you've learnt whilst on your pre-reg year. So for example, it could be questions on clinical governance, on an audit cycle, or they might say you're carrying out or a person's carrying out a set of research. Which of these would be the most reputable resource? Will it be a randomized control trial? Would it be a systematic review? Would it be people's opinions? They could also ask a question on first aid. So a person's nose is bleeding, what steps would need to be taken? Or a person has sprained or strained their ankle, what would they need to do next? Or you could have a question on sleep hygiene. So a patient approaches you saying they're not being able to sleep very well, they don't particularly want to be taking any tablets to help them sleep. What non-medicated methods are there to helping them fall asleep? And actually the NHS website, if you type in sleep hygiene, it's a great resource on ways to help fall asleep, which don't require medication. And you might find actually that patients who come in for the Nitol want a night tablet, and usually, I mean, not always, but sometimes patients that have taken Nitol want a night, they're using it not just once a night, but they're using it quite regularly. So it's important to stress out that it can have addictive properties. And secondly, that maybe they should try these, if they haven't already, obviously, try these non-medicated ways to try and help them fall asleep at night. And if they're relying on Nitol, then they need to go and see their GP. They could also ask questions on the drug tariff, on data protection. So that's what I mean when somebody asks, what questions could they ask? Without trying to scare you, really and truly, they could ask anything. But it's about how do you prepare so that if they do ask you a question on anything, you're able to face it. And the way of that is just making yourself aware of all these different topics, so the BNF, the MEP, OTC, and even all these sort of obscure kind of sections. Trust your knowledge, have confidence in your knowledge. I mean, you've got this far, have faith in that and have belief in that, and I really truly believe that goes a long way if you can believe in your own knowledge. And, you know, practice as many questions and as many papers as you can. Become familiar with the styles and the types of questions that they ask. I mean, another big point that I would say is practice your timing as well, because yes, you need to know the knowledge, but you also need to be able to do it in that time frame, in that restricted time. So try and get practicing with that as well. And read the question carefully. Underline, circle, highlight, whatever it is you need to do, but read the question carefully. and be aware of those little red herrings that they could put in the calculation paper, that they could put in the clinical paper, and don't let that put you off. You know your stuff, just remember that. So hopefully this video has given a bit more clarity into the types and styles of questions that they can ask, and hopefully you found this video useful. And if you did, why not give us a like, give us a thumbs up, comment, share, subscribe, join our Facebook page, and until next time, happy revisings.